Hello, everyone. I hope you're all well, and thank you very much for choosing to join me this afternoon for our next of a three-part series on feline hypertension. And just a reminder on this slide of just some of the key information if this is your first time joining us. So important things to mention would be that we record these sessions, and the recordings typically will be on the website within 24 hours. So if you want to re-listen or if you have any technical issues during the session, be aware that you can listen to the recording tomorrow. And also, if you do want a copy of the slides that I use, then you're very welcome to request those, and I can send you those in a PDF format. So there's no need for you to write anything down that's on a slide. So the focus of this afternoon's presentation is following on from last week, where I talked about what hypertension is and how it affects cats, why it's so important to know about, and in particular, which situations we most commonly see it. The focus for this week is how do we actually diagnose hypertension in a cat? And obviously a key part of that is going to be assessing, measuring blood pressure in cats. So that will be a big focus of today's presentation. I'm going to talk a little bit about the equipment that you can use to measure blood pressure in cats, and some of the advantages and disadvantages as we know things today of those particular pieces of equipment, and just make you aware that there are some challenges. So unfortunately, the methods we currently have are not perfect. That is definitely a key point to take home. Talk about how we actually do the procedure, and a reminder of for any clinicians listening to this of some of the pitfalls that can affect our readings. So for example, what we need to be careful about in terms of positioning our blood pressure cuff. And then lastly, how we interpret the readings that we get. So you probably know from yourselves, if you've ever had your blood pressure measured, which probably most of you, if not all of you, will have had at some point, you probably know what are normal or normal-ish readings for a person, but I'll tell you what's normal or normal-ish for a cat. And then next week, we'll talk about treatment and checkups and that side of things. So in terms of measuring blood pressure, there are two types of machines that are available for measuring blood pressure in cats. And they're both what we call non-invasive machines. That means that they don't involve putting a needle into an artery, which, as you might imagine, is not going to be tolerated by a cat, but that actually would be, if we could get a sensor directly into an artery, that gives us what's called a direct blood pressure, and that would be the absolute gold standard way of getting a measurement, because you're putting your ability to measure blood pressure right in that artery. But of course, no self-respecting cat is going to allow that to happen, in the same way that if we went to our GP surgery needing a blood pressure check, they got out a big needle, we'd probably be a bit concerned as well. So we use in our clinics what are called non-invasive techniques, and that gives us an indirect measure of blood pressure. So that is, for a starter, going to be less accurate than the sticking the needle in. We have to accept that. And then with those non-invasive machines, there are basically two choices. One is the Doppler, which is an example of which is shown on the left-hand side. And that you will see much more of, because that's the technique that I use day to day to measure blood pressure in cats. And that involves a sensor, which I'll put my cursor on now. So this is the sensor, which you place over the artery, and then you can actually listen to blood flow in that artery. And separate to that sensor, you have a cuff which you inflate, and that's attached to a pressure gauge, a sphygmomanometer, and that allows you to collect readings, and I'll explain exactly how that works a little bit later. The other way, the other broad methodology for assessing blood pressure in conscious cats is using what's called an oscillometric machine. And an example of an oscillometric machine shown on the right-hand side. And the main difference is that whereas the Doppler technique is a very sort of manual, hands-on, we're listening to things, a bit like when the doctor does our blood pressure and they put a stethoscope over the crook of our arm, listening to our pulse there. The oscillometric machine is the, sorry, just distracted by a lovely view of a cat there. Thank you very much for that. But the oscillometric methodology is the magical black box that does all its calculations inside. We can't actually see how it's the data it's using usually, and then it tells us at the end, this is what the blood pressure reading is. So it's a more automatic process. You press a button and that will inflate the cuff, which you place on either a leg or the tail. And within that cuff, there is a little sensor, and that sensor can detect wobbles, oscillations in the artery wall. And from those wobbles, as the cuff is inflated and cuts off the blood flow in that artery, and then as it's subsequently deflated, allow the machine to make some very clever calculations that ultimately will say this is what it thinks the blood pressure is. So it's very clever methodology, very widely used in people, but a little bit newer on the vet side of things. And there are pros and cons of both of these machines. So that, as written in this red box here, the number one message is neither of these types of machine are perfect. So I have a preference for the Doppler machine at the moment, based on my experience of various oscillometric machines that have been around on the vet side. In the future that might change, but at the moment my preference is, I think the Doppler is a more reliable way of assessing blood pressure in cats. So if we look just very briefly at the oscillometric machine and some of the advantages of this, this is the automated machine, as I mentioned. So it automatically will inflate, deflate the cuff, and then it actually gives you a lot of numbers at the end, because these machines will give you a number for the systolic blood pressure, which is the higher of the two blood pressure readings, the diastolic, which is the lower of the two blood pressure readings, and then also the mean blood pressure. So you'll get those readings, and often you'll get a heart rate reading as well. So you might feel, well, that's giving me more data. It's giving me more numbers, because typically with the Doppler, you'll just get a systolic reading, or typically that's the easiest one to assess. And certainly these machines, if you do use them, I like the ones which allow you to see the data that the machine is using to give you those readings. And the data should look something like this graph at the bottom here, where you can see there's quite a smooth curve as the cuff is inflating and deflating of what's happening with that artery wall, those wobbles that I described. And that is what the machine is then using to make the calculations. And if it looks a nice smooth curve like that, then you've probably got good reason to be quite confident in the readings that you are receiving. Whereas if the curve is all over the place, because perhaps the cat fidgeted a little bit, if perhaps the cuff is on the tail and the cat's swishing its tail, that can confuse the machine, but you can see it on that trace, and then you know to ignore that reading. Unfortunately, not all of the oscillometric monitors have the ability to view the data, and then that makes me a little bit worried, because you don't know always how much you can trust the readings that it's generating. They tend to be more reliable in animals that have a slower heart rate, and therefore that's why they often perform better in anaesthetized cats compared to conscious cats. So these machines are often quite useful in clinics in their operating theatres to monitor blood pressure. And they tend to be more reliable in dogs than in cats. But in some conscious cats, which is our typical cat that we're worried about with its blood pressure and want to assess it, they can struggle a little bit with their fast heart rates. And also they can struggle because of movement in cats, confusing the sensor within that cuff. So if the cat tenses a muscle, it might be read as something happening with that artery wall mistakenly by that monitor. So I think at the moment, my experience of these machines is that they're quite variable. If I were to buy an oscillometric machine, I would choose what's called a high definition HDO machine, because those have been the most carefully studied. But no oscillometric machine is perfect. Similarly, no Doppler machine is perfect. But I just feel currently, I feel a little bit safer using the Doppler machine because at least you've got a good idea of what's happening. You can hear what's happening, which I find is reassuring. You don't have to rely on invisible algorithms within the black box to produce numbers for you. So other advantages of the Doppler are they tend to be less expensive for vet clinics to buy. So I'm not suggesting that you would buy one, but a typical Doppler unit might cost you about 800 British pounds. So they're definitely pretty expensive, but the oscillometric machines tend to be even more expensive than that, the HDO ones. They're very robust, they last a long time, they're very easy to use. I think they're more reliable in conscious cats, which is why I like them for the cats we've been talking about in our hypertension series. And certainly in a number of studies, they have been more reliable also in conscious cats in terms of correctly identifying cats with high blood pressure. But they're not perfect. They're definitely not perfect. So still, you're not getting a direct blood pressure reading. So like the oscillometric machine, this is a sort of best guess using technology of what the blood pressure might be. So they're definitely not giving you a perfect reading. Also can be more time consuming, a bit messier, a bit more hassle to do in the cat as well. So these are some of the reasons why in vet clinics, you know, some clinicians don't like using a Doppler because they just find it's very time consuming and frustrating experience for them. But my preference certainly at the moment would be to prefer a Doppler machine given the choice, because I feel based on my experience that this is the most reliable technique for a conscious cat. If you are interested in a deeper scientific analysis of some of the papers that have been published about different monitors, I have got some summary information on that. And if you email info@vetprofessionals.com and ask for that, so summary information on different blood pressure machines, what's been published, I can send you that if that is of interest to you. And these lovely pictures of the same patient, this is actually a colleague of mine, Professor Danielle Gunmore, and just an example of a cat that firstly is quite chilled out having his blood pressure assessed. You can see he's not actually being held at all, but you can see also from his facial expression that he actually seems to be slightly miffed about his front leg being held. You know, he's tolerating it. He seems a little bit more cheerful, I think, in the photo on the right hand side. And so this is the first thing to mention in terms of the technique, really, is that we do have a choice. We can use a limb or a tail to make our blood pressure measurements. And some cats, actually, they just don't like their feet being touched. And so the tail is going to be more comfortable for them, and therefore that might influence my choice. However, it is important to know that you will get different readings on the tail versus the leg. Typically, readings from the tail are a little bit higher, although not always, just to be a little bit frustrating. So a key message is that as a clinician, I would always say, write down where you have taken your blood pressure reading, tail or leg, and be consistent so that you can monitor trends in the same patient. Just be aware of some of those issues. And also, as I've put on here, the cuff should be as close as possible level with the heart to give you the most reliable reading. So that's why you can see the cat on the left has this what's often called a handshaking posture. It's like it's shaking paws with the clinician measuring the blood pressure, and that is to lift that cuff to be about level with the heart, and that's going to give you the most reliable blood pressure reading. So what else can I tell you? Well, some of the following definitely applies to whatever technique you use, and this is one of the things that applies to whatever technique you use, which is last week we talked about this phenomenon called situational hypertension, where stress and anxiety can temporarily increase blood pressure. So a key thing we need to consider when we measure blood pressure in our patients is therefore, how can we make this as stress-free, anxiety-free a situation as possible, and really minimize the possibility of that situational hypertension. So I'm just seeing there is a bit of chat going on. Sorry, I'm going to ignore the chat till the end. I hope that's all right, but I will answer your questions as best as I can. And from my perspective, in terms of reducing stress, quiet and calm environment is the first tip. And I think also it's a great advantage for the carer to be present with the cat when blood pressure is being assessed. So whilst you might not always have control over that, and particularly at the moment with COVID restrictions and social distancing, that actually may not be deemed appropriate. But under normal circumstances, I think it's really helpful for a cat to have their carer present in terms of reducing the likelihood of them having a stress associated increase in blood pressure. Next on the list is that you should, where at all possible, and this applies to yourself as well, if you go to the doctor and have your blood pressure, shouldn't really just sort of rush through the door and instantly have a blood pressure measurement collected. Ideally, have some time to just, catch your breath and settle a little bit before that procedure is done. And the same is true in cats. We know having what's called an acclimatisation period, ideally 10 minutes, but a minimum of 5 minutes before you actually start collecting your measurements is helpful in letting the blood pressure just settle down and reducing that the risk of the situational hypertension. So do that where at all possible, whatever method you're using to collect blood pressure readings in your cat. And then if you're using the Doppler methodology, then the next step would be to put your cuff on the limb or the tail. And the key thing really with the cuff, and this also applies to the scillometric technique, is that the width of the cuff should be about 30 to 40% of the limb or tail circumference. So luckily most cats are fairly similar in size, so from a clinical perspective one cuff often is fine for most cats, but if you do have either a very large cat or a very small cat, you might need to use a different cuff to your standard one. But ideally the cuff 30 to 40%, the width of the cuff 30 to 40% of the circumference. And so often I'm using a 2.5 centimetre wide cuff, and that cuff I put on the front leg between the elbow and the knee of the cat, you can see, so it's a very comfortable place for it to be, just on the leg there. And the fact that this cat has a little bit of shaved fur, ignore that, that is not relevant to the technique. This cat had a blood sample collected. And then we prepare the area where we're going to put our Doppler probe because we want to get a really good sound signal. So the area that we put the probe on is shown in that white dotted box there. So it's between what we call the carpal pad, the little pad halfway down the leg, and the main foot pad. And just wiping that down, even just with water, but I usually use a surgical alcohol just to wipe down that area, helps improve contact with the ultrasound gel and gives you a better signal. And then we have lots of ultrasound gel, which is why this procedure is a little bit messy. You need your paper towel handy as well to wipe your hands on afterwards. And definitely a good tip is you can never have too much gel. It always improves the contact and makes it easier to hear your pulse signal. And you also put gel onto the probe itself, importantly, when the machine is switched off. If you put gel on your Doppler probe and the machine is on, it makes the most horrendous noise that you can possibly imagine. And if you hate the sound of fingernails going down a chalkboard, this is a million times worse, I promise. So definitely keep your Doppler machine off at this point that you're putting the gel on. And then still with the machine off, actually place the probe over where you want to listen very, very gently. You don't want to press too hard, and then you can switch the machine on. And as you can see in this heading of this slide, I'm a fan of wearing headphones. It allows me to really focus on what I'm doing and very quietly listen to what's happening. A study done by the Royal Vet College in London indicated that cats don't mind hearing the sound, so it isn't necessarily more stressful for them if you don't wear headphones, but I like to wear headphones. And then you can listen to the pulse signal, and it should hopefully play through your systems now. So I'm just checking the chat box to make sure that, yep, there's nobody saying I can't hear anything. That's good. Videos like this also on my website, so you can hear them there as well. But what you heard just then is a little bit like a steam train with the cat's pulse happening. And also the other lovely thing about this video, I think, is you can see the cat's pretty relaxed, you know, just sitting there having a little bit of a cuddle while the procedure's done. And again, that the cuff is level with the heart. Oops, I may as well play it again. So and another example of the cuff positioning here. So we've got on the left a cat with sitting down and the cuff is on its leg on the floor, obviously not level with the heart. So that is definitely not a good cuff position. We're going to get an unreliable reading as per the information on the right hand side of the slide there. What we want to see is that cuff level with the heart, as in the lovely Casper you can see. So once we've got a good pulse signal, then we can inflate the cuff and looking at the pressure gauge, this is our sphygmomanometer, which has a pressure gauge attached to a sort of pump, hand pump, air pump, which pumps up the cuff. And as we inflate the cuff, we look at that pressure gauge and we see where the pressure is when we can no longer hear the pulse. And we go a little bit higher. And then we will start to deflate the cuff and we look for the point where that pulse signal first becomes clearly audible, where we can first hear that pulse return, and that is the systolic blood pressure. And so in this example here, that's 154 millimeters of mercury. But I'll now show you a short video, the first bit of which has no sound, but just goes through the procedure a little bit more. And this is my own cat Sooty, who you can see is not looking completely impressed with the fact that he's having his blood pressure checked. And I'm just measuring his leg because he's quite a big cat to check what size cuff is going to be appropriate for him, and making sure that he has the right cuff width to be used. And then that cuff is just being put on so it's nice and snug but comfortably on his leg. I've prepared the area where I'm going to put the probe a little bit, just putting on a bit of gel there, and then put some ultrasound gel onto my Doppler probe, and then I very gently hold that in place, and hopefully when I've pressed that red button you'll hear his pulse. So hopefully you could hear that pulse. We cut it off around about 140, and then I inflated the cuff a bit more, deflated it very slowly, and again the signal returned around about 140 millimeters of mercury. And there is a full version of that video with a voiceover throughout on the video tutorial page of the website. It's, I think, in the section probably for veterinary professionals, but you'll be able to see how to measure blood pressure. So we then deflate the cuff completely and repeat that procedure and get a series of readings from which we calculate an average. So what is normal? Well, in a clinic situation, we would like, ideally, your cat's blood pressure to be less than 140 systolic. That is considered a cutoff for normality at the moment. And most cats in a clinic situation will have systolic blood pressure between about 120 and 140. The next category is called pre-hypertension, but also includes cats with this situational hypertension, the stress or anxiety associated increase in blood pressure. And that is where we have a systolic blood pressure reading between 140 and 159 millimeters of mercury. So it could be the cat genuinely has high blood pressure, but it's in this pre-hypertensive category, or it could be that situational stress associated increase. And for cats that we ultimately decide are pre-hypertensive, usually we don't treat them unless they have evidence of damage to those target organs that we talked about last week, the eyes in particular, but also the kidneys, the heart, the central nervous system, or if we can see in an individual cat that trends in blood pressure are very definitely increasing, then that would be justification also for treating at this level rather than waiting for it to get even higher. But for a lot of cats, actually, the stress, the situational anxiety can put the blood pressure into this sort of region, and those are cats that obviously don't need treatment. Cats with genuine hypertension, by definition, have a persistent blood pressure of 160 millimeters of mercury or higher, and that's further subdivided into a moderate risk of target organ damage with the hypertensive cats, the left-hand side of this slide, versus a severely hypertensive cat where systolic blood pressure is 180 millimeters of mercury or higher, and there is definitely a very high risk of target organ damage, high risk of damage to the eyes, central nervous system, heart, and kidneys. So we will categorize our patients into each of these categories, but importantly, even for these cats, there still is the possibility of stress taking blood pressure into that level. And I certainly have had many cats over the years with situational hypertension where I've had readings over 200. There can be a really massive temporary increase in blood pressure readings in some cats, and some cats are probably more vulnerable to this than others. So we need to be very careful not to misdiagnose hypertension when a cat is stressed. And that's the next big question that I want to finish off with here, is how can we then distinguish between a genuine high blood pressure and one that is temporary associated with stress, that's situational hypertension. And these are the steps that I go through when answering that question. First thing is to make sure I do as much as I can to collect any blood pressure readings in as calm and cat-friendly an environment as possible to really reduce the risk of situational hypertension from happening in the first place. And I'll show you a list of my sort of top tips for that in just a moment. Next on my list is to look for target organ damage. So in particular, look at the eyes, because if you do see evidence of hypertensive damage to the eyes and you've got a high reading, even if you've only got one high reading, if the damage to the eyes is very definitely looks like it's caused by hypertension, then you can make the diagnosis that way. But if you haven't got that situation, you need to confirm that that high reading is persistent, that it's not just a one-off, that the cat was stressed on the journey to the vet, for example. And the guidelines on this slide are those that are recommended currently by the International Renal Interest Society, IRIS, that have a lot of guidelines on managing cats with kidney disease. And any of you that listen to the kidney sessions that we did will know that high blood pressure is a common complication of kidney disease, which is why they have guidelines on monitoring blood pressure as well. And basically the summary of these guidelines is, as far as blood pressure is concerned, if it's very high, you want to monitor it quite frequently to make that judgment as to whether it's persistent or not. But if the blood pressure is a little bit lower, you can perhaps take a bit longer to make that decision, because it's likely it won't be compromising your patient too much. Next on the list would be to look for other evidence of target organ damage, such as increased loss of protein in the urine, and also consider looking for underlying diseases that we know are associated with high blood pressure. So that might be the sort of sequence of events that we'd follow. But importantly is making sure we're cat friendly, and that's where I think it's a real advantage if you can be present with your cat when their blood pressure is assessed, which, as I've already said, may not be possible at the moment with the social distancing requirements that we need to follow for our own health and safety in terms of coronavirus, but normally would be absolutely ideal is for you to be with your cat and able to reassure it whilst this procedure is happening, and also for the clinician collecting the readings to take plenty of time. if your cat is very anxious about vet clinic visits, then something that might be worth talking about with your clinician is gabapentin, which is not a veterinary licensed medication, but you may have heard of it as a painkiller used in people, particularly with nerve pain, neuropathic pain. Gabapentin in cats can be used for pain relief, but also it, particularly in initial dosages of treatment, can be a little bit sedating to cats. It can make them a little bit sleepy. And this side effect has been exploited a little bit by clinicians in recent years, that if you have a very anxious cat who really, really hates going to the vet, and who can blame them in so many ways, but actually giving some gabapentin at home before the vet visit can be very calming and doesn't have an impact on blood pressure readings. So it doesn't confuse our ability to diagnose this condition, but it can make it a lot less stressful for the patient. So if you have a cat that's in that category, then that might be worth considering. The hands-off technique at the bottom is if you do again have a really difficult cat that really won't tolerate being handled, then of course an oscillometric machine, one of these more automated machines that you can put on the cat and then put it back into its cat carrier and press the button outside the basket to collect the readings, might actually be less stressful for the cat and might let you get some readings. So you might not be able to do the Doppler, but you can do something. We look at the eyes to see if there are damaging evidence of high blood pressure, and this little cat, Audrey, you can see has very abnormal looking eyes. In the picture in the background, you can see where she's looking at the camera, she's got very, very large pupils, the black of the eye, which in cats is often quite slit-like, this vertical slit-like pupil. She now has these really round, large pupils, and that often is associated with blindness. And she was a cat that suffered from this very sudden onset blindness. So you can see her eyes look abnormal in that respect, but also if you look at that close up at the front where I'm now shining a light in the eye, what you're actually seeing here within those pupils, within that black space, is that her retinas are detached. So you can see, again, I'll put my cursor over, but these are blood vessels at the back of the eye, which we don't normally see when we shine a light into our cat's eye, but we can see them in Audrey because of her retinal detachment. So she is one example of the sort of changes we might see. I think I showed this picture last week. Occasionally we'll see bleeding in the eye that's visible at the front of the eye. So that also it can be a clue of hypertensive damage. And then another example of retinal detachment. So Audrey on the right, a different cat on the left, where again through, this is a much better camera that's taken this picture rather than my phone, but this you can see here we have again a retina with lots of blood vessels. You should not be able to see that looking at the eye without special equipment, but this is just shining a light at this cat's eye. It has a retinal detachment. And lastly, some pictures of the back of the eye. So any of you that know what the back of a human eye looks like may have some ability to interpret these. The white blob on the left-hand picture is the optic disc. So this is the nerve that collects all the information from the seeing layer of the eye, the retina, and takes that to the brain. And then we can see blood vessels here, which are not really very red because of the photograph, but these are blood vessels. This is a normal fundus on the left, but on the right hand side you can see there's lots of splodges of bleeding, so there's hemorrhage, there's lots that's very fuzzy because of edema, swelling of the retina, and there's a little aneurysm on one blood vessel. There's all sorts of changes there. This is a really typical severely hypertensive eye. So if we see that and the cat has a high blood pressure reading, we can tick we've got the diagnosis. And then once the diagnosis is confirmed, we can move on to treatment, which is the subject for next week. And even in cats that are completely blind, and even if that blindness has been present for some time, actually vision can return to some degree, probably in around about half of those cats. Even those cats that do remain blind, often I think their quality of life is very much improved with treatment anyway. They feel a load lifted off them, I think. But of course, wonderful if you can get some return to vision, the best chance of that has got to be with the earliest treatment. So I would always say, if you see any problems with your cat's eyesight, view that as potentially an emergency and speak to your vet clinic as soon as possible, because if it is due to hypertension, then earlier treatment probably is going to help the outcome. So in summary from today, Doppler and oscillometric machines are available, and they both have their pros and cons. Definitely neither is perfect. I prefer the Doppler for some of the reasons that I've shared with you today, but you know, other clinicians do use other machines, and we're all looking for hypertension as being defined by persistent blood pressure above 160 or above. And if we have a single high reading and very clear evidence of target organ damage, such as that retinal detachment or hemorrhage that I showed you, then we've confirmed the diagnosis, we can go on to treatment. But if we're doing, let's say, a routine healthcare assessment and we have a high reading, but the eyes look absolutely fine, we need to confirm that that abnormality is persistent before we start treatment, because otherwise we could be misdiagnosing a cat that is just stressed and has that situational hypertension. There are some other resources that might be of interest to you. So on the right-hand side of this slide, I've got two that you can download if you Google ISFM consensus guidelines on hypertension, and also the ACVIM, the American College of Veterinary Internal Medicine consensus statement on hypertension. These are both aimed at vets, both of these articles, so you may find them a little bit technical, a little bit in a language that is not completely familiar. However, if this subject is of interest to you, I think you may still find that you do actually gain from looking at them, so potentially of interest. And if you do want a copy of these slides or the additional slides I mentioned earlier, please do feel free to get in touch.